morning. Today we'll be talking about ovarian cancer, which is the common cancer in women, and we're talking about what every woman needs to know. Thank you, Dr. Chinenye, for coming on the program. It's always a pleasure to have you here, and also it's a pleasure to welcome you, Dr. Ohazurike, to this episode of Doctors on Air. Now, Dr. Chinenye, you are an oncologist, and Dr. Ohazurike, you are a gynecologist. Could you explain the difference in your roles and what it means to the patient who has ovarian cancer?
Thank you. It's a pleasure to be here as always. So as you mentioned, I'm an oncologist. So that means my role in the treatment of ovarian cancer is mostly to give chemotherapy to ladies who require that treatment. So the chemotherapy can either be given before surgery or after surgery. So my treatment would be what we call systemic treatment. So it would go all over the body, treating the ovarian cancer, even if it's spread to other organs.
Dr. Ohazurike?
On my own part, the role of a gynecologist is actually make diagnosis. Most of the time, the women present to us first, and then we evaluate and come to a diagnosis. And again, we operate, after which, if the patient requires chemotherapy or adjuvant treatment just means that we give treatment to give after surgery, then we refer to the clinical oncologist.
Thank you. So what is ovarian cancer and how common is it in Nigeria?
Yeah, ovarian cancer is a common gynecological malignancy. In Nigeria, it is difficult to come to give you data because we don't have data per se. But it's quite common. We see a lot of them. And the important thing is that there are different types of cancer that could occur in the ovary. And it depends on the cell line that the cancer is developing from. It can be epithelial, it can be cell stroma, it can be germ cell. But the commonest is the epithelial type, which constitutes about 95% of ovarian cancer. And the epithelial one is the epithelial type of ovarian cancer is the one that tends to also be familial. I'm sure you must have heard about BRCA gene mutation. Yeah, it tends to occur. The women who have BRCA gene mutation are more susceptible to developing epithelial ovarian cancer, especially the serous type.
Dr. Chinenye.
Just to expand on what Dr. Ohazurike has already said. So as we know, the ovaries are part of the female reproductive organs. And so if you have cells in those ovaries that start growing and dividing uncontrollably, and then they form lumps, and the lumps get bigger and bigger and bigger, and then start spreading to other parts of the body, that is what we would constitute or call an ovarian cancer. And like Dr. Ohazurike says, there are many different forms of that cancer and the different treatments according to the types of ovarian cancer we're dealing with.
So what are the different stages of ovarian cancer?
So basically, you can have ovarian cancer that's just confined to the ovary, so it's just in one particular area, or it might have spread regionally. So it might involve some of the glands or lymph nodes around the ovary, or it might have what we call distant metastases. So it might be affecting the lining around the ovaries in the stomach or abdominal, so in the abdominal areas, so between your chest and your pelvis, or it might spread even further than that. And you might get things like fluid building up in the abdomen, which is what we call ascites, as a result of the ovarian cancer as well. So basically, we would talk about local ovarian cancer, regional ovarian cancer, or distant ovarian cancer, depending on how far it may have spread. So you can also have staging. We talk about, T1, T2, T3, T4. We talk about the lymph node involvement, and then we talk about whether there's metastatic disease, so i.e. has the cancer spread, and that is how we would stage the ovarian cancer.
Dr. Ohazurike, can you tell us what are the signs and symptoms of ovarian cancer?
Yeah, so unfortunately, ovarian cancer symptoms are quite non-specific. And what I mean by non-specific is that there is nothing that you can say this is ovarian cancer. This problem you're having is because you have ovarian cancer, because other conditions could present similarly. However, one common symptom or the common symptom that they tend to have, which women should look out for most times, is that many times they come down with they feel bloated, they have early satiety, in other words, they eat and then they feel full on time. All right, then these are the early signs or early symptoms that they tend to have. And then subsequently, then they start having abdominal distension, and if there are metastases, they start having signs and symptoms of metastasis. All right, so the fact that ovarian cancer symptom is quite non-specific is one reason why most women present very late. More than almost more than 95% of women who in our environment who come down with ovarian cancer come to us with metastatic disease, at least stage 3, stage 4. So the problem is that the symptoms are non-specific, and then most times they present to other doctors. They keep shopping from one hospital to another, trying to get find answer to their problem, not knowing that it's actually ovarian cancer that they have.
Dr. Chinenye, can you
Yes.
tell me or can you tell us the risk factors for ovarian cancer?
So it's quite rare for ladies to get ovarian cancer when they're younger. So it's only over the age of 50 and most commonly between 60s and 70s that ladies will have ovarian cancer. There are other factors such as being overweight. Actually, that's one of the risk factors, being overweight or obese. Also, it depends on when you had children. So if you had your child when you were over 35 years old, or if you haven't ever had a complete pregnancy, that increases your risk of getting ovarian cancer. And also it depends on your family history. So if you have other people in your family who've had ovarian cancer, that would put you at a higher risk. And also other cancers such as breast cancer and even colorectal cancer. So as Dr. Ohazurike mentioned, you sometimes have genes that might be hereditary. So they run through the family, like the BRCA gene, which is common in breast cancer. That same BRCA gene, which is common in breast cancer, can sometimes also be a risk factor for developing ovarian cancer as well. And sometimes after ladies have gone through the menopause, if they start HRT, so that's hormone replacement therapy, that can put them at increased risk of ovarian cancer, and also a condition called endometriosis. So basically your weight, your age, how you've had your children, if you've had them late in life, family history, and using hormone replacement therapy. Those are the main risk factors. However, if you have had children at a younger age, so under the age of 25, and you breastfed your children, and even the use of the oral contraceptive pill, those three factors can reduce the risk of developing ovarian cancer.
Can ovarian cancer affect both ovaries? And how is ovarian cancer diagnosed?
Yeah, ovarian cancer can affect both ovaries. In fact, the fact that both ovaries have what I may call tumor on them puts that at a higher risk of being ovarian cancer, because a tumor on the ovary can actually be benign. But most tumors on the ovaries are benign. But when you have bilateral tumor, in other words, tumor on both ovaries, that's a higher risk of being malignant, being a cancer. Diagnosis of ovarian cancer, just like any other disease, starts with history, examination, and then investigation. Most times the woman will come to you. Like I said, many times they come very late with distended abdomen and so on. All right. So taking a history, you have a suspicion, and then you examine the woman. Sometimes you feel a mass in the abdomen and so on. And then imaging studies. All right. Simple ultrasound study, ultrasound scan can show that there is a mass on the ovary, and then the mass is suspicious. And then following that, we can go ahead and do tumor markers. Tumor markers are more like proteins that the body produces in response to the presence of a tumor. All right, so the tumor marker may be elevated, like in the case of ovarian cancer, the common tumor marker that we use is CA125. Sometimes we use CE, and then if it is a germ cell tumor, they have their own tumor markers too. So having put all of that together, we can then come to a diagnosis of ovarian cancer. And then following that is the treatment, the staging and the treatment.
Are there screening options for ovarian cancer?
So unfortunately, we don't tend to have an actual screening program for ovarian cancers because in order to have an effective screening program, you need to have tests that can be done that are low cost, not very invasive, and that will detect the cancer early on, and so that the risks of those screening tests do not outweigh the potential benefits. So we don't have a set screening program for ovarian cancer. However, if you are someone who has one of these, something that puts you at higher risk. So let's say you are known to have the genes in your family that can predispose you to ovarian cancer, or you have someone else in your family that has had ovarian cancer and you consider yourself high risk, then you can go ahead and get tested using this blood test that Dr. Ohazurike mentioned, the CA125, and that can be used as a potential screening tool. But no, we do not have a set screening program for ovarian cancer. I think that as with any cancer, actually, the key is early diagnosis. And even though we don't have a screening program, the issue we have, particularly in our environment, is people going from place to place to place trying to get the diagnosis. So I would say, be aware of the symptoms. This abdominal swelling or bloating, weight loss, fatigue, feeling full very early. So you notice that your appetite has gone down and you feel full as soon as you start eating. If you notice any of those, then seek medical advice sooner rather than later. And get them to do the appropriate investigations. And then if someone says to you, they think this is a diagnosis, then please just go ahead and also make sure that you get the treatment. There's treatment now, and the treatment can actually be very successful. If you catch ovarian cancer at an early age, then the survival rates can be very, very good. It's only when we find it at a much later stage that, yes, we can still treat it, but then the outcomes become a little bit less successful. So early stage diagnosis, treatment at any stage, and it's not necessarily a death sentence at all.
Thank you, madam, for coming on the program to share your experience with us. We really appreciate this. Can you tell us about how you found out you had ovarian cancer?
Good evening.
Good evening. No. Carry on.
It all started 1999. 2019. I started with a lower abdominal pain. Initially, I didn't know what was wrong with me. I went to the doctor and I was told that I had ulcer. So I was treated with and with ulcer drugs, and I was okay. I went home. So probably after 6 months, it occurred again. I went back to the hospital and now opted for CT scan, that I want to do abdominal scan. I opted for that, not the doctor. I did, because he was still treating on ulcer. He was treating ulcer. So, and I told him, no, I want to go for CT scan. So he asked me to go. I went for CT scan. So when the result came out, I was told that they are seeing something in the ovary that I need to go for further examination. So I went for a specialist. I went to a specialist doctor this time around. So when I got to the doctor said the scans upstairs for biopsy, that they should do biopsy based on what they found out in my ovary. I said, okay, no problem. They now booked me for biopsy. So when I got to the hospital, in the course of doing the biopsy, the doctor said he has found out something much more than what they are expected to see and all that. So he said he wants to go ahead for the total hysterectomy. I said, okay, they should go ahead. I gave them the consent. So after which they went for the biopsy and they discovered I had an ovarian cancer. So I was now directed to Lakeshore in Lagos. So that was where I went to, and I was treated.
Thank God. And so that was over 2 years ago that you had
Yes,
the problem.
going to 3 years now.
Going to
Yes.
3 years. So that's fantastic. And I think that's also a testament to pushing for when you haven't, when you know you have there's something wrong. I think it's always important to keep on pushing until you have a satisfactory diagnosis. So thank you very much for that. So can I ask you, how did you feel at that time when you had the diagnosis, and how do you feel now?
Oh, I'm feeling much better now. Much better than then. Then I wasn't eating, I wasn't doing anything. I was sad and all that, but now I'm much better. I'm okay.
Thank you, madam, for sharing your experience with us. Can you tell us, did you have the kind of support that you required during the process of this illness? How do you feel about the support you had and the reaction of the people around you?
I think it was a personal thing. It was a personal thing because I know how the society look at, when you're sick, and, people say a lot of things and all that. So I decided not to. I just kept it to myself. And then I reported officially to where I work, but then not to my friends. Few families I did, but not to my friends, no.
Thank you so much. But all in all, the treatment you had in Lakeshore, how did you find the support they gave you there?
Very wonderful. They are I really appreciate Lakeshore Hospital. They did a wonderful job, honestly. I didn't regret going there. I live in Abuja. I go from Abuja to Lagos every 3 weeks for my treatment, to the end of the treatment. So I really appreciate them. They did a wonderful job.
Thank God for that. We thank God. So do you have any words you want to say to our listeners out there, who some advice to them that you could give or share?
My advice is, like the Dr. Ohazurike said, I don't think there's a specific sign for ovarian cancer. That's the truth, because when I had it, I was not even expecting anything. I'm the kind of person that is very strong. So if you have any issue that has to do with stomach, please don't narrow it to ulcer. Go further. Even the doctor is telling you this or that, please go ahead and do much more investigation than what you are asked to do. That was what I did.
Okay.
And eventually I
properly treated.
By his grace, I'm free. Yeah.
Thank God. Thank God. Thank you so much. Thank you for sharing. Chinenye, with your work at Lakeshore, I know you see a number of these patients. I think this is a very good, as it were, testimony to the work that you're doing there in terms of treatment of ovarian cancer and other cancers. Can you just elaborate more on the kinds of treatment that our guest would have had?
Yes, so as our guest mentioned, surgery is a key part of the treatment of ovarian cancers, but I work at Lakeshore Cancer Center, and so we would give more systemic treatment. So things like chemotherapy would be something that we would give. And also there's some newer treatments called targeted therapies that we would add to the chemotherapy treatment. And we can also use those treatments sometimes to maintain a response to the cancer. So if the cancer has already shrunk down or responded well to the initial treatment, then you can continue that maintenance treatment as a means of reducing the chances of the cancer coming back. And we do have access to all of those medications and all of those drugs here in Nigeria. So I would encourage people to seek medical help, especially at specialist centers, so that they get the right care.
Is it possible to prevent ovarian cancer?
In terms of prevention, we have things that, like I said, would reduce the risk factors, but actually, if you can just have a healthy diet, try not to get overweight, because I said being overweight is a risk factor. And things like, it's difficult to call it prevention, but it's things like getting the age that you get pregnant. So it's not really, there are no actual things other than having a healthy lifestyle, avoiding smoking, healthy diet, and healthy weight. And those will reduce the risk of you getting the ovarian cancer.
So,
If I may come in here, if I need me
yes.
to come in here, yeah, talking about prevention, just like she rightly said, have a healthy lifestyle, all right? And then if you have a familiar tendency, all right, there is also what we call risk reduction surgery. For instance, people who have BRCA gene mutation, a very good example, I mean, someone that comes to mind very readily is Angelina Jolie, right? Whose mother died of breast cancer, and then she did the genetic study and found that she had genetic mutation. She has a genetic risk I think 40 something percent risk of developing ovarian cancer. So what she did, completed her family site and took out her ovary. That can reduce your risk of developing ovarian cancer as much as over 90 something percent. All right. And then some people have also talked about doing what is it called? When you have finished having your babies, you want to do family planning, that taking out the fallopian tubes can also reduce your risk, because many of the ovarian cancer that we have today have been, studies have shown that a lot of them actually have their origin in the fallopian tube. So taking out the fallopian tube may also reduce your risk.
Is there a chance of giving birth after ovarian cancer?
Yes, there is. I've had ovarian cancer in young people, especially the germ cell tumor. Germ cell tumors occur mainly in young people. The youngest person I've seen with a germ cell tumor is less than 5 years old. And for such a person who has germ cell tumor, you want to conserve her fertility as much as possible. So you are not very aggressive when you are operating. Luckily, germ cell tumors are very, very chemosensitive. So you do minimal surgery as much as possible. You want to conserve the fertility. Some of them end up growing up to have their babies later in life. So it's possible to still conceive after ovarian cancer. And then again, even apart from the germ cell tumor, even the epithelial tumors, if you pick a woman up as stage 1A, that is limited to one ovary, and the capsule of that ovary is not ruptured, you can actually conserve if the woman wants to. But hardly do we see women at stage 1A. Most of the people we see are already stage 3, stage 4
Okay.
for the epithelial ovarian tumor.
Dr. Chinenye, can you tell me, do you often or do you ever advise patients, particularly young women, to have, freezing of their eggs? The facility is available at the Bridge Clinic and so on. So do you advise, would that be something you could advise a person so that they could actually have children later on in life?
Yes, I think for any young ladies who are aiming to have chemotherapy or any form of treatment that could affect their fertility, yes, it is definitely advisable that they can, if they can afford it, it would be a useful thing to store their eggs. And even for young men, I know we're talking about ovarian cancer, but to just go through those fertility treatments so that you can then readdress the option of having children later on. So yes, that is something that we discuss as well.
Yes, I think it's very fortunate we have places like the Bridge Clinic and so on that can actually do these things here in Nigeria. So it's important that we do take advantage of some of these things that would help in terms of quality of life, I think, later on, because it can be quite challenging. But as with our guest, I think she's already, coming out of it. She's already looking forward to a whole new world, a whole new life post-cancer. And I think that for me is the most encouraging part, is when I see patients like her that have overcome, that have had their treatment and are on their way up. I think for me, that is such an important and such an encouragement for people to seek treatment and to actually have their diagnosis made earlier, as opposed to the way we normally do it, which is putting our heads in the sand. But still, though, sadly, our patient is anonymous. And the whole issue that comes up again is the issue of stigma in our society against people who are unwell. What can we do about it? What do you think?
I think it's very important to have conversations exactly like this. so that people can demystify the illnesses and cancer in particular, and know that, you know, we have a lot of people have negative connotations with cancer or illness in general. So having conversations like this where people can come out and say, it's not a death sentence, it is treatable, there is life after it, and we don't have to have a stigma surrounding the cancer. I think those are the main points that I would say are important in making sure that the message gets out there.
Dr. Ohazurike, why do people think that you can catch cancer? You know, people think you can catch cancer. A lot of the issues are, don't let me go near this person, just in case it jumps on me, or just in case the bad luck that brought it to this person jumps on me. And the whole issue of dealing with that area of our society.
Yeah, it's actually lack of education. Actually, there is nothing more. It's lack of education, and that is why we need to keep educating our people. And that's why, for one, I never had problem jumping on this program. The moment I was told, I had to come up first. I mean, it's an avenue to reach out, let people know that this thing is not contagious, right? It's not contagious. It happens and nobody ever invites cancer. Say cancer come. Yeah, we may have an unhealthy lifestyle that predisposes us, but nobody ever opens his mouth to say cancer come. All right, so we need empathy, we need everything, I mean, shown to these women or anybody with cancer at all.
Yes,
But the important thing is that it's not contagious.
Can ovarian cancer cause irregular bleeding or affect menstruation?
Yes, just like we said earlier, there are different types of ovarian cancer. It can be epithelial. Epithelial is cancer cancer arising from the covering of the ovary. And then we have germ cell tumor. Germ cell tumor is actually cancer arising from the egg that women produce. And that is why that kind of cancer is commoner in young women who are still menstruating. And then we have pesco stroma tumor, which are cancer arising from other ground substances inside the ovary, and they tend to be functional. When I mean functional, I mean that they tend to produce hormones. All right, one of the functions of the ovary is hormone production, estrogen, progesterone, and all the rest of them. So when you have cancer arising from those cells, right, they tend to produce a lot more of those hormones, and they could cause abnormal bleeding. A very good example is a cancer we call granular cell tumor. All right, granular cell in the ovary produce estrogen. All right, so once you have granular cell tumor, a lot of estrogen is being produced, and that estrogen goes ahead to stimulate the uterus. So when the woman bleeds, she tends to bleed excessively, or she bleeds abnormally, and some of them can go ahead and develop a secondary cancer of the uterus.
Can ovarian cancer be detected in a pap smear test?
No, not at all. Ovarian cancer has no connection with the cervix, so you can't detect it. Occasionally, if it was cancer of the womb, you may be able to pick some cells that will tell you that yes, there's something going on inside the womb that could be cancerous, but not ovarian.
How does the doctor detect the stages of cancer?
For ovarian cancer, there are different ways to determine stage. But for ovarian cancer, the staging is surgical. All right. In other words, when you say somebody has ovarian cancer, you take the person to surgery, and then at surgery, you will carefully stage that person by first and foremost palpating and feeling for different parts, and then taking respective samples that you send to the lab. At the end of the day, you come up with what the stage of the disease is. So staging of ovarian cancer is surgical or surgical pathology, because you need to test some of the specimen you collect to determine whether there is actually cancer spread to them. So that's the thing. You have to operate to stage ovarian cancer.
Dr. Chinenye, what are the risks stroke benefits of different kinds of treatment?
Yeah, so that's very important. So in terms of the different kinds of treatment, with the systemic treatment that I give, so for example, chemotherapy, we know that chemotherapy, yes, it's aimed to kill off the cancer, but it can have side effects as well. So it can cause you to feel, tired, your appetite can go down, you can be more at risk of having infections, for example. But that's why it is so important to make sure that you're getting that treatment at a specialist center, so that we would, like, for example, at Lakeshore, we always make sure that as you're going through the chemotherapy treatment, we're monitoring you every week and supporting you with medication to deal with the side effects, and also adjusting the dose of the chemotherapy as well if needed. Obviously, with surgery, you have other potential risks. So, there's always the risk of, for example, bleeding or an infection, or the complications of the surgery itself, which Dr. Ohazurike will know better than me. But obviously, you would want to be in experienced hands so that they can take out the tumor and obviously perform the hysterectomy appropriately with minimal complications. And also there's the fact that once you've had that surgery done, and like I said, with chemotherapy as well, that can obviously affect your ability to have children in the future. So that is something, a frank discussion that you would need to have with your surgeon or your oncologist before you embark on the treatment. But obviously the benefit is that that you would then hopefully be cured of the cancer, or at least have the cancer controlled for a significant period of time. And as our guest has said, you should end up feeling a lot better thereafter and be free from the illness.
Is radiation a suitable treatment for ovarian cancer?
We don't tend to use radiation very much in ovarian cancer. No, it's not something that is very sensitive to radiation, I have to say. It's the mainstays of the treatment would be the surgery, chemotherapy, and targeted therapies.
Ovarian cancer symptoms are very non-specific. So if as a woman, you're having this bloating, you're having early satiety and all the rest of them, and you check with your doctor and you're treated and you're not getting relief, please don't stop there. Get the scan. And I'm also saying this because I'm sure there are doctors listening to us. Please get your patient scan. It's very, very important. Ultrasound scan, that's the least you can do. The problem in our environment, we know there's a lot of poverty. We know we have poor health-seeking behavior and all the rest of them. But a woman comes to you having symptoms of all these GIT symptoms, and they are non-specific. Please get a scan. All right, very important. Abdominal pain, just get a scan. It's very important. I can't overemphasize it, because the earlier you take this thing, the better.
Thank you so much.
If you can catch the ovarian cancer at an early stage where it's localized, you can have a survival rate. We talk about the chances of being here in 5 years. We're talking about survival rates in the 90s, like 93%. So it can be dealt with very effectively if we catch this cancer in the early stage. So yes, both educating healthcare professionals to be more proactive in getting scans, and patients in seeking that advice from the healthcare professionals as well. I think that's what I would want to emphasize.
Do you have any last words, Dr. Chinenye? The program is already over.
As always, the time has gone too fast, but I would like to definitely thank our guest for coming on and sharing her story. And I would like to just ask the listeners to take encouragement from that story. So seek help early, and know that it is treatable. There is life after cancer. Thank you.
Thank you. Thank you very much.